Welcome to Inspiration Health Radio, sponsored by Millennium Physician Group. I'm Michelle McCormick. March is Colorectal Cancer Awareness Month, and while we don't need an entire month to be aware of this deadly disease, it is important to talk about a cancer many think can be uncomfortable. Today, we're going to talk with several experts about how colorectal cancer is preventable with proper screening and lots of awareness. But first, Millennium Physician Group is a leading comprehensive independent physician group in Florida with more than 700 healthcare providers at 150 locations in 19 Florida counties, serving nearly 500,000 patients. Millennium Physician Group is your connection to a healthier life. You can learn more at millenniumphysician.com. Connection, innovation, Inspiration Health. Every week, we're talking about healthcare issues that are important to you. We invite providers and experts to inspire you to take control of your healthcare decisions. Join us right now for a healthcare journey as we work together to achieve the best health outcome for you. Well, according to the American Cancer Society, colorectal cancer is the third most common cancer diagnosed in both men and women in the United States. While screenings and lifestyles have changed for the better over the years, the likelihood of developing a colorectal cancer is about 1 in 23 for men and 1 in 25 for women. With better screenings and education, early detection can be the key. All right, our first guest today, I'm so excited to welcome Millennium Physician Group's Dr. Shaya from our Sunbeam Road office right here in Jacksonville. Dr. Shaya, thank you for taking time out of your day with patients to talk with us today about this very important awareness month.
Hi, Michelle. It'd be my pleasure.
Well, give us a little bit of background about yourself, Dr. Shaya.
Sure. I am a family practitioner by trade. I completed my med school training at Ross University in 2003, completed an internship, internal medicine, for a year at St. John's Hospital in Detroit, and completed 3 years my family practice and board certification in 2007. So I've been practicing for a while. My passion for family medicine and preventative care.
Mm-hmm. Yeah, and how long have you been in Jacksonville?
I've been in Jacksonville for approximately 7 years now.
And you're never leaving, right?
No, I'm not.
Gonna stick around for a while.
Quality life.
Yeah, we're happy to have you, Dr. Shaya. So in the family medicine area of primary care, how often do you see patients that are complaining about a stomach issue? It's got to be pretty prevalent.
It is. It is quite prevalent. I would say in my practice, probably at least 10 to 20% of patients have some abdominal symptoms of some sort that are chronic, and some patients actually get used to it and they don't report it as much. But, you know, when asked about it, they do report it more often than you think.
Mm-hmm. Do you think a lot of people are just kind of like pushing it off to, oh, I ate something bad, I'm allergic to wheat, what do you tell these patients that might have something more than just a food problem?
Right. So you really got to tease down and talk about details and causes of where the pain started and how long ago it started. And obviously, colon cancer is on top of our list. We got to think about, because prevention, as you know, is key. I'd rather prevent something than deal with the problem. And somebody might not be thinking about it as a big problem and might say, "Oh well, I'll deal with it. It's not a big deal. It's just gas, or it's just stomach or acid reflux or something of that sort, and it'll go away." And it might not for a while. And you might mask it by taking over-the-counter medications or some other recommended medications by a friend or some sort who had similar symptoms. But at the end of the day, really, and I've uncovered so many serious problems relating to abdomen just by addressing the problem and doing a few studies and a physical examination. So it is extremely important to address abdominal symptoms with a physician before trying to treat with over-the-counter medications or even brushing it off as something benign.
Mm-hmm. What are some of the risk factors that could lead to colon cancer?
Oh, there are a few. Age being one of them, and dietary genes, are some of the few predisposing factors for colon cancer. And really, recently, the U.S. Preventative Services Task Force has changed the recommendations to start screening for colon cancer from 50 years of age down to 45 years of age and up to 75 years of age. Reason being, we've been discovering more and more colon cancer earlier in life, along with other pre-malignant lesions like polyps and so on and so forth, that could turn into cancer, colon cancer, in years down the line. Again, obesity is another risk factor for colon cancer as well. So there are quite a few risk factors, and it's tough to truly determine how long it takes for it to form. I've discovered colon cancers that developed within a year or two from having a colonoscopy. So getting a colonoscopy is obviously paramount, but follow-ups periodically, even if your colonoscopy is clean, follow-ups with physical examinations and seeing your doctor every 1 to 2 years are also important.
Mm-hmm. What are some of the signs and symptoms that when patients are coming to see you, Dr. Shaya, that you're like, I think it might be time to refer out to the gastroenterologist?
Right. So first of all, you don't necessarily need to have symptoms. So having symptoms are extremely important. And I look for red flags. And sometimes red flags, can have the patient end up in an emergency room and not just have time to have a gastroenterologist evaluation. Abdominal pains, obviously, that are moderate to severe, they warrant imaging, and depending on how bad they are, can have you end up in the emergency room, but not always. So getting in to see your physician early is key here. Do not delay it if you're starting to have abdominal pain. Call your doctor, try to get an appointment, because your body's trying to tell you something is wrong. It's not all that you have gas or, a little bit of acid reflux that you can deal with or treat with some baking soda or gas ice. So you truly need to call your doctor and go in to see them to get screened for more serious conditions.
Yeah, I couldn't agree more, Dr. Wisdom-Shaya with our Millennium Physician Group office from Sunbeam Road. What other advice do you give? You were saying, gas and acid reflux. What about like irritable bowel? People just, I think we're so busy that it's just hard to say, you know what, I'm just going to kind of, ride this pain out for a little while.
Absolutely. Stress is a big factor in our lives. And you have to understand that it causes psychosomatic symptoms, and you'll end up with things like irritable bowel as well, that can cause abdominal discomfort, pain, sometimes constipation or diarrhea, and it varies. And it's treatable. And if we're not able to treat it with the simple tools that we have in the primary care doctor's office, after obviously weeding out more serious conditions such as appendicitis or diverticulitis, treatment with antibiotic is simple nowadays. Getting a CAT scan to see the true reason for your symptoms is simple to get at this point, and relatively cheaper than what it used to be. So if we fail to find a reason for the cause of the symptoms, obviously at that point, the gastroenterologist needs to come in to assess further with colonoscopies or endoscopies or such other tools. Mm-hmm.
I think education is key as well. It shouldn't be a dirty topic to talk about, especially with your physician. If you're having, I just find people have a hard time talking about it.
Right. No, it truly is. And everybody does not want to waste their time on something that is truly benign, but and the internet has been a great resource, but it's also been very confusing for a lot of patients. And I love it when patients are self-educated and they go on the internet and they try to find things that cause their symptoms. But you got to understand, it's very tough to tease out the good, the bad, and the ugly in your symptoms and figure out what's truly serious and what's not, what's an early sign and what's not. You cannot delay your doctor's visit and trying to get some answers and clarification on what could be causing your symptoms. at this day of age. Yep.
Yep. Well said, Dr. Shaya. Well said. Dr. Shaya from our Sunbeam Office Road right here in Jacksonville with Millennium Physician Group. Thank you so much for joining us today. I really appreciate it.
My pleasure. Thank you for having me.
All right. Well, coming up in the next segment, we're going to talk with a physician from Borland Groover, Florida's largest gastroenterology clinic, about the importance of colonoscopies. If you've been avoiding this procedure, you're going to want to listen in. Stick around. Inspiration Health Radio, sponsored by Millennium Physician Group. We'll be right back. Welcome back to Inspiration Health Radio, sponsored by Millennium Physician Group. I'm Michelle McCormick. Each week, we're talking about the healthcare issues that are important to you. We invite providers and experts to inspire you to take control of your healthcare decisions. March is Colorectal Cancer Awareness Month, and while we don't need an entire month to be aware of this deadly disease, it is important to talk about a cancer that many think can be uncomfortable. Today, we're going to talk with several experts about how colorectal cancer is preventable with proper screening and awareness. And joining us right now is Dr. Kevin Kumar. He's a gastroenterologist from Borland Groover Clinic. Welcome to the show, Doctor. Why don't you give us a little bit of background about yourself and what led you to working at Borland Groover?
Yes, my name is currently Kevin Kumar. I am currently the vice president here at Borland Groover, also a general gastroenterologist who practices with Borland Groover. Originally from Ohio, born and raised. My wife and I kind of trained together in Virginia. We wanted to stay someplace warm. Ended up in Florida, where I joined this practice some 13, 14 years ago, and been practicing ever since then.
Well, that's wonderful. I think it's important to talk about colorectal cancer and to have a whole month dedicated, the month of March. I think it's also something that we just need to talk about year round. But while we're in the month of March, we're going to discuss colonoscopies and the whole procedure. But why do you think colonoscopy is such a dirty word?
You know, to be honest, I truly don't know. I mean, colonoscopy, unfortunately, gets a bad rep. It has bad PR. Women feel very comfortable talking about mammograms, but discussing colonoscopies shouldn't be any different. While the concept of having a colonoscopy no one likes, the idea of getting a colonoscopy, truth is not really that bad or difficult. Mm-hmm. What most people don't realize is that the worst part about getting a colonoscopy is actually the prep. The most painful part is probably them placing an IV. And as time has gone on, the prep has tremendously improved, gotten better. And if normal, most people only require a colonoscopy every 10 years. With the advancement in prep and anesthesia, the procedure is pretty painless. And at the end of the day, it saves lives. It's highly effective. To me, I don't really think of colonoscopy. I always tell my patients, I don't think of colonoscopy as being a dirty word. Colon cancer to me is a dirty word. So it's a great tool, and it's very effective. I just think it just gets bad PR.
Yeah, I couldn't agree more. I've had several colonoscopies, and the prep, you know what to expect. Let's talk a little bit about the advancements in the prep.
They have tremendously improved. There's multiple preps now that individual gastroenterologists choose for patients, a lot less volume. Some of them are only a few glasses of liquid. Some of them are more complex. Some of them are split over time. The preps vary per patient, per physician, and physician preferences. But compared to the old days where you drank jugs and jugs of liquid to kind of cleanse you out, those days are gone.
Yeah, I do recall my first one having like that 3 a.m. pill or something and drinking more. And it was just like, oh, this is super painful in more ways than one. So you mentioned a little bit ago the effectiveness of colonoscopies. How effective are they for detecting colon cancer, and at what stage? The earlier the better, I'm guessing.
The data is clear. Colonoscopies are an excellent screening test. It captures about 94% of all colorectal cancers. And more importantly than capturing colon cancer, it also prevents colon cancer. Colonoscopies help detect and remove colon polyps, which are these growths that occur and are often the precursor to colon cancer. So the detection rate is greater than 90%. Not only detection, like I said, but hopefully for early prevention from ever even developing colon cancer.
Is there a new standard now at the age of which you can, at one point I think it was 50. Has that changed any?
Yes. So currently we are seeing colon cancer in earlier individuals, and the screening age has been dropped to 45. So in individuals with no family history or symptoms, we recommend that everyone be screened, male or female, at 45. Now, obviously, the recommendations vary a little bit if there's a family history or patients are having symptoms. But generally speaking, in a healthy individual, colon cancer screening is recommended at the age of 45.
Mm-hmm. So about those polyps, if they are detected and you do remove them, what's the process following?
So what happens if any polyps are detected during the procedure? They're often removed. Obviously, if they're too large or complicated, they're not removed, but most are removed. At that point, the tissue that is removed is sent to a pathologist who examines the tissues, the growths, and determines whether the pathology is cancerous, precancerous, or just benign. This helps us to determine how often you need to be checked, how aggressive you need to be evaluated, and how to proceed after the removal of the polyps.
Are polyp, and you said they vary in size. What prevents a polyp from being able to be removed?
I mean, typically, if it's in a very critical place in the colon, mm-hmm. or by a large blood vessel, the most common indication for not being able to remove a polyp is just generally its size.
Okay.
If it's flat or it's very large, that we feel that it needs to be removed surgically or through a different technique, that's often recommended.
Okay. So outside of the colonoscopy itself, you could have to go back in to do that removal. Yeah. How is a polyp developed?
It's people always ask me that, how did I develop this? How did I develop colon cancer? How did I develop polyps? Most of it is, luck. There is a genetic component to it. It's a mutational change in the mucosa of the colon, which causes a small growth like you get anywhere on your skin, like a mole or anything else in the body. And over time, the fortunate thing is that most of these take a long time. They grow, and as they grow, they can become cancerous and change, and that's why they're removed.
Mm-hmm. All right, so it's March, and that means a lot of conversation about colorectal cancer. And then you see these commercials, right? I hear them on Spotify. I see it on TV about Cologuard.
Yes.
Let's talk a little bit about that. Can you explain what Cologuard is?
Yes. So Cologuard is a non-invasive screening tool for colon cancer and precancerous polyps. What it does is it takes a stool sample at home that you test and looks for DNA changes in microscopic blood in the stool. The test is kind of collected in the privacy of your home. Once your sample ready, it's sent to a lab, and therefore it's tested. It's different than a colonoscopy. A colonoscopy examines the entire colon. During the colonoscopy, you get a visual examination. So you're not only able to detect colon cancer, but you also detect those things we talked about, colon polyps or growths that can turn into cancer. This is what is, I think, the big difference between a colonoscopy and Cologuard testing. What most people don't realize is Cologuard is used to kind of tell us whether you have colon cancer, but not really tell us how to prevent or helps prevent colon cancer.
Okay.
Typically, individuals who get a Cologuard test require it to be done every 3 years. With a colonoscopy, if it's normal, then you need to be tested every 10 years. Like I said, the Cologuard can detect signs of cancer, and maybe some advanced polyps, but it's not really designed to help prevent it, to remove those polyps. The other thing is that what patients often tell me about is that Cologuards can have false positive tests, which means the test can come back positive, and it doesn't mean you have colon cancer. Mm-hmm. This would obviously lead to another test, which is like a colonoscopy, which is the gold standard to evaluate the false positive or positive test. There are things that can cause the Cologuard to be positive, like blood and stools from your hemorrhoids. Things like that can kind of sometimes throw the test off that are very common.
Mm-hmm. Yeah, I understand that. And, I guess they're really helping in getting the conversation started,
yes.
through the commercials and stuff. So, well, Dr. Kumar, thank you so much for joining us today from Borland Groover. How do we get in touch with your office?
We're very prevalent all through Jacksonville. We're obviously the premier group here in Jacksonville and the largest GI group. Google, that's the best, easiest way. Call an appointment, and we affiliate with all the hospitals in the city, with all the referring groups. So.
Yeah, you're one of our biggest referrals groups in town as well. So thank you very much. I appreciate your time today and your insights and help about learning more about colonoscopies.
No problem.
Coming up in the next segment, Michelle joins us. She's going to talk about her colon cancer diagnosis that happened at age 38 and how her journey to recovery led her to discover a hidden passion. The conversation will continue. Inspiration Health Radio, sponsored by Millennium Physician Group. We'll be right back. Welcome back to Inspiration Health Radio, sponsored by Millennium Physician Group. I'm Michelle McCormick. Each week, we talk about the healthcare issues that are important to you by inviting providers and experts to inspire you to take control of your healthcare decisions. Well, March is Colorectal Cancer Awareness Month, and while we don't need an entire month to be aware of this deadly disease, it is important to talk about a cancer many think can be uncomfortable. Today, we have talked with couple physicians about how colorectal cancer is preventable with proper screening and awareness. But joining us now is an actual patient. Her name is Michelle, and her story is very unique, from the young age of diagnosis to a reoccurrence to now being a survivor. So joining me today on the show right now, I'm so excited to have Michelle Otto here with us. Thank you, Michelle, for taking time out of your day and really to come and talk about this really important cancer that a lot of people don't want to talk about.
Thank you for having me too, Michelle.
Yeah. And so you're super young. You're a mom.
Yes.
Give us a little bit of background about you and what led you to getting your prevention and screening.
Well, it all started in 2017 is when I was diagnosed with stage 4 colon cancer in February. Immediately went into surgery the next week because it was about to rupture out of the colon area.
So did you have any signs of anything going on? I mean, what was the process to getting to the stage 4 diagnosis? That's so scary.
So I did have signs. It was almost a year's worth of signs that I kind of brushed off and pushed to the side, just having 2 young children. The signs came when they were 5 and 3, and I was running a lot, so I kind of discouraged myself from any pains in my stomach.
Right.
Even blood in the stool.
And how old were you at the time?
I was 37 when I was having symptoms, but 38 when I was diagnosed.
Wow, that's really young.
Yes, it is.
Yeah.
And my colon cancer is a sporadic colon cancer. So it's not the hereditary type, but it is sporadic, and don't know why it happened, but it did. Right.
And so you were active. 2 young kids you're chasing after. You're an active mom, a runner. And what you said, you were just kind of just like, you know what, that I have pain in my shoulder. I just kind of brush it off.
Exactly.
But it was more of like a stomach internal pain.
Yes. And then it got to the point where it was just too much to bear. And so I went to the doctor and they said, okay, you need to have a colonoscopy done. It could just be hemorrhoids, but it could be something else. And went to Borland River for my colonoscopy, and sure enough, when I came out of the colonoscopy, was the bad news.
And what did they tell you? Because I've had a colonoscopy before, and they're like, yeah, you had a couple polyps, we removed them, we don't think anything's wrong with them, we're going to go have them analyzed, we'll call you. I'm guessing that wasn't your response.
No, there were definitely polyps in there, but there was actually a 1.5 centimeter size tumor.
Oh my goodness. And so, wow, is that how what are the stages? Do you know? I mean, you were stage 4, which is the worst.
Yes, it is. For the fact of the size and I guess the location perhaps, but then also it was about to grow outside of the wall of the colon. And once it does that, then it goes to other parts of your body.
Okay.
Other organs, in other words.
Okay. So take us through, if you don't mind, the next 24 hours.
I was numb. My husband was in the room when I came out of the anesthesia, and the look on his face kind of said it before Dr. Corregidor could even have the words come out of her mouth. So I was numb, went home, went into bed and just cried.
Yeah.
Just wondering, oh my goodness, what am I going to do? I have these little ones.
Right.
But I was in great hands with the doctors, and they did an amazing surgery. Recovered from that. They had removed about 14 lymph nodes that were around the tumor, and there were no signs of those lymph nodes being affected. So I thought, great, I'm good. So my oncologist had just said, okay, after surgery, we're just gonna, do blood work 3 months later. Since none of the lymph nodes were affected, we feel like we caught it in that one location. And sure enough, those few months go by, and I do my blood work, and my tumor markers are extremely high. I was feeling tired still in between, those.
Had you gone back to running in the active level that you were at?
Not really. I mean, I couldn't with the type of surgery that had happened. So with my tumor markers being high, they went ahead and did a CT scan the next day and saw a tumor larger than the one in my colon in my liver.
Oh, goodness.
So it had metastasized into the liver and grew quickly within those 3-4 months after having the first surgery.
Oh, goodness. So, wow, the numbness came back, yes, I'm guessing?
Definitely. And I'm thinking, oh my goodness, what now? And of course I had to go into chemo and try and, shrink the tumor because the location was on the liver. It was close to, I'm not sure, just a spot that they didn't really want to do surgery on.
Right. Just very difficult placement.
Yes. So I went and did several rounds of chemo, which is never wished upon anybody. It is basically death in a nutshell.
I don't even want to know. Yeah. No, I get it.
Yeah. So after I had several rounds of chemo, I was able to do the liver resection with, again, great hands keeping me here.
Yes.
And after I recovered from that surgery, I did 6 more rounds of chemo.
So that all happened in 2017?
Into 2018 as well, yeah.
Oh, goodness.
Exactly.
Goodness.
Yes. But
so
I'm cancer-free.
Yay!
My remission started in July of 2018.
Okay. And, what's it been like since then as a colon cancer survivor and now a liver cancer survivor,
well, it's
or
not liver cancer? It was the same type of tumor.
Okay, so it still falls under the colon cancer. Okay,
yes,
all right. Yes. Thanks for clearing that up. What's it like? I mean, what do you feel like now as 3-4 years later, post COVID even?
Yes.
How terrifying was that for you?
Yeah, I am so happy now. Like, it puts a new light in your eyes. You go day by day and you have your livelihood, and then something, bad happens or gets, thrown in your face. It's something that you don't want to happen. And then it just kind of opens your eyes to other things, and it humbles you a little, and it makes you spend time with your family more, your friends more, what you want to do for yourself and what you want to do for others.
Right. Yeah. Right. Well, so what advice would you give another young woman or a young man who might not have a history of colon cancer in their family? What advice would you share?
Well, if you're having any type of symptoms for anything that's health related, get it checked. I mean, I'm a fortunate story. I did wait too long, but it could have been rectified a lot easier and a lot quicker if I would have took myself to the doctor sooner and tried to do some preventative type care, or just even, asking questions to a doctor.
Yeah.
Like, this is my symptoms right now. What's going on?
Well, and at 37 too, you really just don't think of yourself in that category,
because they say, 45 and above to have a colonoscopy done. But I mean, if you're experiencing anything, do it. Don't worry about the money. Don't worry about the time. Get it done so then you can live a healthy, long life.
Agreed. I'm talking with Michelle Otto. She is a colon cancer survivor. And Michelle, you took this devastating news and years of your life and battle with chemo even, and turned it into something that you're passionate about. Let's talk about what you're doing now as a busy mom still.
Yes.
I'm sure. Yes. Are you back to running?
I am. Not as much, but I do work out. And with COVID having had been, I just kind of put ourselves in a bubble a little bit.
Yeah, of course.
What if I caught it, what would happen, or if my children caught it. But yeah, so now I'm getting back out. The weather's so beautiful in Florida right now. I went on a run today.
Yeah, there you go.
Yes. So I started a company, Luke and Olive, which named after my 2 children, because they're the ones that really brought me through to want to survive this cancer, what I had to go through. And one day I was hand drawing little cancer ribbons, and I made it into a design that I made into jewelry, and said, you know what? I'm healthy. I'm here. I want to do something more. And let me start this business.
Yeah.
of inspirational type items. And if it puts a smile on anyone's face, I'm happy.
Yeah, I saw your designs at an event actually, and I was so impressed. And your mom was right there with you the whole way, and just that support that you have. And then I found your company on Facebook. So how do we find you and help and look at these beautiful designs that you have?
Yep, I am on Facebook business, so it's Luke and Olive. I do sell on Etsy, Luke and Olive shop on Etsy. And I'm trying to get into more expos, like where you saw me at the Donna Expo. You know, it makes sense to have these cancer products available, you know, for other survivors or other people that, you know, are trying to remember somebody.
Yeah, they're beautiful.
Yeah.
Do you do anything custom for people going through other than colorectal cancer, but maybe breast cancer or,
Yes.
you know, other?
I can do anything custom.
Yeah, that's
Or
awesome.
put the color, you know, the color ribbon to a piece of jewelry that I have, or, you know, if you want something special done, I can definitely come up with that.
Aw,
with my
well-
creativeness.
So, Michelle, are you going to be at the March to Get Screened event that Borland Groover does every year?
Yes, I am gathering a team of runners, walkers, and people, and we will be out there.
That's awesome. It's March 27th. It's Sunday. It takes place at the Riverside Arts Market and in the parking lot area there. It's all along the North Bank. It's really pretty where they do the course. I was out there last year. Millennium is a sponsor, and we will be out there again this year. Michelle Otto, thank you so much for joining us. Please continue to share your story. I think it is very important for young men, young women all over. And, you know, I have to say, my mom is 72 years old and she's getting her first colonoscopy this year, right? And I'm like, what took you so long? She's like, I never had any symptoms. I'm like, Mom, you really just don't know.
Yeah, you don't.
So thank you for sharing your story. I really appreciate you.
Thank you so much for having me.
Well, coming up next, we are going to talk with a representative from Borland Groover about the March to Get Screened event that's coming up later this month. So you're going to want to stick around to get all the details about that fun event. You can see myself and Michelle at the event too. Inspiration Health Radio, sponsored by Millennium Physician Group. We'll be right back. Welcome back to Inspiration Health Radio, sponsored by Millennium Physician Group. I'm Michelle McCormick. Every week, we're talking about the healthcare issues that are important to you by inviting providers and experts to inspire you to take control of your healthcare decisions. Well, it's March, and we've been talking the entire show about Colorectal Cancer Awareness Month. And even though we could be talking about this subject all year round, it is nice to have a month dedicated to it because it's a cancer that makes people a little bit uncomfortable. So right now, joining us is a representative. This is Marcia. She's from Borland Groover, and we're going to talk about their big March to Get Screened event coming up later this month and the history behind it and how you can help. So Marcia, thank you so much for being able to join us today. I just had a great conversation with Michelle Otto, who is a colon cancer survivor, and she is planning on attending. So we are a proud sponsor. So give us a little bit of background about March to Get Screened.
Yeah, well, thank you for that introduction. You know, March is Colon Cancer Awareness Month. So every March for the last 13 years, we've had a annual 5K event and 1 mile fun run, and it's called the March to Get Screened event. And it's really for families, it's for colon cancer survivors, it's for cancer supporters to come out and enjoy the day with their family. It starts at 7 a.m. with registration opening, and then the 5K starts at 8 a.m. and then the 1 mile at 9 a.m. But it really is just a fun day. We have runners that do the 5K, and it is a timed run, and they do get medals. And then we also have the 1 mile fun run that's more for maybe kids or families that just want to come and have a nice stroll. And then there's usually, we have like food trucks, we have face painting, balloon artists, and a fun zone for kids. So it's just, we have a really good time celebrating and creating awareness, and all the funds that are raised for this event, they help patients in need. So maybe it's somebody that has been diagnosed with colon cancer that can't afford their bills, or it's for the person that needs to be screened and can't afford to be screened. And it's also just to raise awareness about the importance of colon cancer screenings.
Mm-hmm. Yeah, you guys do a great job. Everything's blue. There's big balloons. There's a lot of music happening, pictures and videos going on. And the course is really nice, too. We were there last year. My husband had just been coming off of a terrible COVID pneumonia diagnosis that he had. And this was his first 5K coming back to fitness, and he's excited to break his time from last year this year. So we really look forward to Borland Groover does a great job with this event. What why did you think why did Borland Groover decide at some point that they needed to give back, if you will?
Well, it all started. We had a person that was diagnosed young. She found that there was no support groups out there for colon cancer, people diagnosed with colon cancer. So that's the reason why we started this race. Her name is Jan Pratt, and she still comes out every year and supports us. And it's just amazing to see her, and also all the she supports us from behind the scenes. And it's just amazing to see all the people that we get to meet, and all the families that have been impacted by colon cancer. And it's just a good time to kind of come together and create awareness in our community. Right.
I noticed last year also a lot of doctors come out. Dr. Kumar was on the show earlier today, and he was talking about the importance of colonoscopies. So, that fact is never forgotten during the entire event, is the purpose driven behind the reason of March to Get Screened. Give us a little bit of the details about when it is, how do we sign up, how do we bring large groups with us to this event? And you said it's extremely family friendly. How do we get involved?
So what you do is you can go to marchtogetscreened.com, and you can sign up and register, and you can create your own team if you have somebody that you're supporting that is a colon cancer survivor or that's currently going through colon cancer, and you can name it in their honor or in remembrance if you've also lost someone to colon cancer. So that is marchtogetscreened.com. And then after you sign up, you pick out where you're going to pick up your packets, whether it's race day or at one of the first place sports running places, and it'll be listed in your registration packet. And then you meet us under the Fuller Warren Bridge on March 27th. And registration opens at 7 a.m. If you decide you don't want to register online, you can show up the day of the event. And that's 7 a.m. on March 27th. And then the 5K will start at 8 a.m. and the 1 mile fun run at 9 a.m. And then we have an award ceremony at 9:30. Yeah. And of course, if you don't want to walk or you don't want to run, you can also just enjoy the festivities. And that usually includes, family fun events and food trucks and things like that.
Right. And some vendor tables as well. And I remember last year there was a big colon you could walk through. That was kind of cool. It was like this big blow up colon. People were like, yeah, this is different,
Yeah. And then we have a survivors tent. So, people who are colon cancer survivors can be recognized and kind of come over and talk about their experience. We also have a share your story place where if somebody wants to talk on video, they can come out and share their story on video. And I usually do that part, which is interesting because I get to learn a lot about, what they've gone through and, where they are and how everything's going. And it's just
survivorship. Yep. That's awesome.
Yeah,
that's awesome.
It is. It's just.
Well, Marcia, one more time, give us the website and where we can sign up for this fun event. It happens on March 27th. It's actually at where Riverside Arts Market is usually held under the Fuller Warren Bridge. So it's a beautiful location. The run takes place right along the boardwalk there, too, if I remember correctly. Is the course the same?
Yes, the course will be the same. It'll be up on our website. If it's not already, I will make sure it gets posted up there on the website. But the website is marchtogetscreened.com, and like you said, it's under the Fuller Warren Bridge where the Riverside Arts Market is, and everything kind of starts at 7 a.m. and it's just a kind of a morning event. So come out and join us in the morning, and then you can head on out throughout your day.
It sounds amazing. Marcia from Borland Groover, thank you so much for talking to us about this really important event to bring awareness during Colon Cancer Awareness Month. So thank you, Marcia.
Thank you.
The conversation will continue next time on Inspiration Health Radio. Your healthcare journey is very important to us, and our goal at Millennium Physician Group is to work together to achieve the best health outcome for you. Always starts with seeing your primary care provider. See our website for a full list of offices and providers at millenniumphysician.com. In good health, I'm Michelle McCormick. Have a great day.